On behalf of the Northwest Mental Health Technology Center, welcome to today's webinar, Peer-Delivered Services, a Broad Exploration. We're grateful so many of you could join us to learn more about this important topic, and we look forward to sharing and exchanging information with all of you. My name is Adrienne Scavera, and I'm the Training and Outreach Director for Mental Health and Addiction Association of Oregon, or MHAAO, one of Oregon's oldest and largest peer-run organizations. And I'm presenting today with my colleague, Janie Gullickson, our Executive Director.
Hello and welcome everyone. Glad you're here with us today.
The MHTTC Network is a nationwide network that is supported by the Substance Abuse and Mental Health Services Administration, SAMHSA, with the purpose of disseminating and implementing evidence-based practices for mental health disorders into the behavioral health workforce. The Northwest MHTTC is based at the University of Washington in the Department of Psychiatry and Behavioral Sciences. We provide training and technical assistance in evidence-based practices to Region 10 of Alaska, Idaho, Oregon, and Washington. Broadly, our goals at the Northwest MHTTC are to ensure availability and delivery of free, publicly available training and TA to Region 10 providers, to heighten awareness, knowledge, and skills of the workforce, addressing the needs of individuals with mental illness, accelerate adoption and implementation of mental health-related EPBs across Region 10, and foster alliances among culturally diverse mental health providers, policymakers, family members, and clients. It is our intention to always be mindful of using language that promotes recovery and culturally appropriate terminology. We encourage everyone to use and champion person-first language, which emphasizes the individual, not the condition or diagnosis. And with that, I would like to introduce myself and my colleague Janie, and then we'll get started with our presentation on peer services. As the Training and Outreach Director for Mental Health and Addiction Association of Oregon, I work to support the peer workforce from initial entry and training to systems level advocacy, while utilizing both my lived and professional experiences. Janie, Executive Director of MHAAO, is a person in long-term recovery and has lived experience navigating multiple systems. Professionally, Janie holds an MPA/HA in addition to peer support certifications. We'd now like to see who we have with us today. If we could launch our first poll, please. So we've launched our first poll, which asks about your role, as well as how familiar you are with peer-delivered services. We're going to leave this up for a moment to get some additional responses. I see plenty of folks are responding. Thank you for that. So it looks like when it comes to who we have with us today, a majority, well, about a third of us are peer support specialists, and a number of people also identified with roles that were not listed within the poll. And we've got about 12% each who are peer supervisors or clinicians, and then our smallest percentage is healthcare administrators, with social workers coming in at 11%. As far as familiarity with peer-delivered services, I see that almost a third of this group today is extremely familiar with peer services, followed by, at 20 and 21% respectively, slightly familiar and somewhat familiar, 18% moderately familiar, and just over 10% not at all familiar. So thank you all for taking a moment to respond to that poll. We could close that now, please. Our broad walk through peer-delivered services today is going to touch on many topics. We'll start with a look at what peer-delivered services are, including a very brief history. Following that, we'll consider common misconceptions around peer support. After addressing some of those, we'll dive into peer-delivered services as a profession with a focus on implementation and supervision. Finishing up our wide overview, we will review some of the existing research on peer support before opening up to a question and answer period. And I'm now going to let my colleague Janie share some information about our peer-run organization.
Thank you, thank you, Adrienne. Thanks, everyone, again, for being here. I'd like to just share a little bit about the Mental Health and Addiction Association of Oregon. We are a fully peer-run organization with 99% of our staff who identify as having lived experience of mental health and/or addiction recovery, as well as over 51% of our board of directors. And as you can see, we offer direct peer support recovery mentor services, technical assistance, and we also train for peer certification. So what is peer support? And a good analogy that I like to share, it was a story I heard and it is stuck with me, is about the person that fell in the hole. And so person falls into a hole and a doctor walks by, looks down in the hole, says, "Oh, I see you were in a hole. Here's a prescription. I hope this helps. Take 2 of these and call me in the morning," and goes about his way. The next person is a therapist and walks by the hole, looks down in the hole and sees the person in the hole and says, "Oh, I see you're in a hole. Can we talk about it? Do you accept that you were in the hole? Would you like to share how it feels to be in the hole?" And goes about their day. The third person to walk by the hole was a peer support specialist and looks down in the hole, sees the person in the hole and jumps in the hole down there with them. The person in the hole says, "What are you doing? Now we're both in the hole." And the peer support specialist says, "Yes, that's okay. I've been here before and together we're going to get out of here." So a peer-delivered service worker is someone who has their own lived experience of mental health and/or addiction problems and recovery. They've made a personal commitment to their own wellness journey, recovery journey, journey of discovery. They have done this for a period of time and are willing to share their lived experience to support others on their own person-directed path to successful recovery, and that they believe recovery is probable for all, and it is the expectation. They work collaboratively with the person they are serving and can potentially be part of multidisciplinary teams. And they have been trained in ethics, legal responsibilities, confidentiality, other privacy and mandatory reporting laws, but most importantly, how to share their own lived experience in a way that it inspires hope and stays true in their support work to the core values and principles of peer support.
And thank you, Janie. And I'm wondering if we could use a moment here to get a quick sense from all those who are on this webinar with us today. And I'm wondering, when I say peer support, what is the first word that comes to mind? And please type that word in the chat box, because we're curious to hear, what is that first word that comes to your mind when we say peer support? Thank you. I'm seeing a number of responses come in: experience, connection, advocate, mentorship, equality, hope, hope multiple times, peer helping peer, connection, hope, lived experience again, victory, recovery, mentor. Wow, thank you all for taking a moment to think about that question and help us understand your sense of peer support and what first comes to mind. Mutuality, experience, strength, and hope. Wonderful to see all of these words. Resiliency. Thank you. And now, Janie, if you would take us into a brief history with that grounding of what peer support means to all of us here in this webinar today. Thank you.
Yes, thanks everyone for sharing those words of strength and what peer support means to you. So here's a painting, and I'd like to share a little bit about what's happening in this painting. Back in 1793, a chief physician at a hospital in Paris, France, Dr. Philippe Pinel, was way ahead of his time. Pinel regarded mental illness primarily as the result of excessive exposure to social and psychological stresses. His approach to mental illness was one of restoration and expected recovery. Can be very different from a lot of our experiences today with that all too popular medical model that offers a lifetime of illness prognosis. Dr. Pinel recognized the value of employing recovered former hospital patients as hospital staff, and he praised these peer staff for being gentle, honest, and humane, averse from active cruelty, and disposed to kindness. Dr. Pinel hired former patient Jean-Baptiste Poussin as the hospital governor, the first known peer support worker, seen here removing the chains restraining a woman in distress. The hiring of people with lived experience of being a patient in a psychiatric hospital marked a shift in the philosophy of mental health care that ushered in the moral treatment era. And then fast forward to the early 1800s, mutual aid societies appear and Native American recovery circles, where people with lived experience of mental distress and addiction, offering support and inspiration to those going through that as well. In 1810, Dr. Benjamin Rush advocates for the creation of sober houses staffed with reformed drunkards. We can see that in Oxford houses today and many other shared living recovery homes. And peer support has existed in various forms for many years in self-help support groups, grief groups, parenting support groups, and of course, 12-step recovery groups. And then in the 1970s, the consumer survivor ex-patient movement was born as a civil rights-like movement where people had been disempowered and not able to say for themselves what it was that they wanted in their care. And in the 1980s and 90s, funding started to become available for peer groups and the movement became more organized.
Thank you, Janie, for sharing some of the highlights of that very brief history of peer-delivered services. Now I'm going to take us through some of the most common misconceptions about peer support that we've frequently seen come up in our work in educating organizations, systems, and leaders about peer-delivered services on our next slide. So we've got listed here some of the most common misconceptions that we've seen, and I'd like to address all of these today. So sometimes there may be the belief that peer staff are too fragile to handle the stress of the job or work full time. And I think that in fact, peers, those of us with lived experience, folks in recovery, have incredible resilience and incredible strength that we bring with us into these roles and into other jobs that we may have. Managing a person's wellness and recovery is a commitment and an important process. And this is where effective supervision can be important because we can receive support around self-care and making sure that we are doing what we need to do to be our best selves. Recovery can be difficult and peers are incredibly resilient. When it comes to concerns about relapse, I want to acknowledge that all employees take time off because of illness or health needs. Many folks who do not identify as peers take time off because of behavioral health issues. And the same expectations for accommodations, sick time, leaves should be applied to all employees, including peer staff. I also want to look at this belief that peers may replace existing roles. The role of someone in peer support is its own unique discipline. Peer support provides an important role that many times can complement existing behavioral health services that a person might be receiving. In fact, peer support might actually make another person's job that much easier because peer support is effective. And when peer support is able to stay true to our role and values, we really see some incredible effects as a result of that. I also want to look at the concern about administrative demands. Sometimes folks may join this field and maybe they haven't worked for a while. And that's okay. Folks can be supported to be successful around administrative tasks and be supported to manage those administrative details on the job and be provided supports to enable them to provide whatever required task administratively is a part of that position. And the final misconception that I'd like to take a moment to talk about today is that peers will encourage criminality or those types of behaviors, or that we will cause harm that will then have to be undone. So as with all other types of employees, peer staff are expected to follow policies and regulations around confidentiality, HIPAA. Training and supervision support this. And peer staff are just as responsible as other team members for keeping personal information confidential and private. And there's no reason to believe that this would be any more difficult for peer staff than it is for other team members in an organization. And if we could please launch our second poll, where we will be checking in about how many peer support specialists work in your organization. So if you'll take a moment to respond to how many peer support specialists, and I acknowledge there may be other terms that are used, maybe recovery mentor, maybe peer wellness specialist, maybe other terms, does your organization employ or contract with? I'm seeing a number of responses come through at both ends of the spectrum here in terms of numbers employed or contracted with. So looking at these results, about a third of those who responded to the poll have 10 or more peer support specialists that their organization contracts with or directly employs. And then interestingly, the next highest percentage that we see at 23% of respondents was 0, no peer support specialists. Followed by 19% between 1 to 3 peer support specialists employed at or contracted with the organization. And then 16% of us have between 4 to 6. And finally, in the smallest category, between 7 to 9 peer support specialists at 8% of respondents. It's great to see that there's so many of us, a little bit over a third, that have more than 10 peer support specialists that your organization works with. So now that we've looked at some of the history and misconceptions around peer support, let's consider peer-delivered services as a profession. Peer-delivered services is a unique discipline that supports choice and is based on the recovery model. It's based on the belief that all can recover. In 2007, the Centers for Medicare and Medicaid Services, or CMS, recognized peer support as an evidence-based model of care and tasked states with determining training and certification guidelines. Currently, almost all states across the US have a training and certification system, and that involves background checks, peer support training, and other certification requirements. though we might see variations from state to state. Peer support is specialty driven based on the lived experience of the person providing the supports. There is peer support for mental health, for addictions or substance use disorders, for youth, for families or those who have raised individuals experiencing behavioral health, and so on. Peer-delivered services support and promote recovery, and there are research-based positive outcomes, which we will be discussing a little bit later in this webinar. And then my colleague Janie will be taking us through our next slide, which is looking at steps to successful implementation. Thank you, Janie.
Thanks, Adrienne. So there are quite a few strategies and things to consider when launching peer support services in your organization or contracting with a peer-run organization to begin offering peer-delivered services as part of a multidisciplinary team. Preparation is key. So especially as we've seen, peer services just exponentially increase in popularity and recognition over the last several years. Sometimes systems or organizations can get ahead of themselves and get very excited about hiring a peer specialist without doing the homework first. So preparation is huge. And recruitment. You want someone that has that lived experience that you're looking for, whether it is mental health or addiction, substance use disorder recovery, things like that. And considering that they are also ready to be in the workforce and are a good employee all the way around. Hiring just for lived experience is often not going to work out. You're looking for the whole package in hiring a good employee. And ongoing development, always ready to course correct, especially when peer services are in a medical setting or a very clinical setting. Supporting the peer specialist to stay true to those core values and principles of peer support, and how are the other staff collaborating and including the peer support specialist. And then evaluation to highlight the value added by having peer delivered services on the team or in the organization. So before hiring, make sure those job descriptions, please clearly define the roles and responsibilities, and that they are congruent with the scope of work of peer support specialist as a profession. Always including that lived experience as a core component. And then the training of the partners and clinical teams, the systems, the even other non-clinical staff to work with the new peer specialist. And post-hire, there are opportunities for peers to engage in continuing education and workforce development, and to stay part of the recovery movement and the peer workforce as a whole. Social work has their societies, other professions have professional professional societies. And so peer support may not necessarily have that in your area. So having them be able to collaborate and talk to and share experiences with others in the peer workforce is just vital. And then there are conferences, both national at the state level, to increase support networks and those educational opportunities and to promote that workforce development. And there are a lot of resources, including this publication, Enhancing the Peer Provider Workforce, Intentional Peer Support and Co-Supervision, INAPS, Core Competencies, as well as the pillars of peer support supervision. But always throughout the process, ensuring peers are included in all aspects of the program development. Hiring and supervision. As I mentioned before, it is a competitive process. You are looking for a good employee. And by hiring well, it also reduces the possibility of tokenizing a person with lived experience just because they have that lived experience. And therefore, it's not that single qualification. And follow those universal policies on hiring employees. And for supervision, depending on the program or the funding stream, there could be potentially two types of supervision, administrative and consultative, but primarily of primary importance is to have a peer supervisor that knows the work, ideally has done the work themselves, and it creates a career path, a non-clinical career path for people with lived experience in the peer services field. And then in situations such as billing Medicaid, there's often the requirement of an administrative or clinical supervision, or there may not be the budget or the bandwidth to have a peer supervisor in that organization. And what's really recommended is that clinical supervisor be trained in peer support so they have the knowledge of the scope of work and how to support that position. Also, you know, it is different when the supervisor doesn't have that peer support background. And sometimes if they are a clinical therapist, for example, you want to avoid potentially playing therapist in a supervisor's role, and other things to be avoided.
Thank you, Janie, for that information about implementation and hiring and supervision of folks working within peer support. We're going to take a look now at some of the relevant research highlights. The beauty of peer support can also be a challenge when it comes to evaluation. The flexibility and variation of its delivery and programs. Given that this field is still relatively new in terms of being a unique discipline, more research is being developed as the recognition of peer-delivered services grows. With respect to longitudinal research or research that has taken place over a longer period of time, we can see some aspects of peer support like coaching and mentoring. There's some longitudinal research around those, but we're hopeful to see more research, especially more longer term, taking place to really show the incredible benefits and value of peer support in the future. Several studies have found that peer-delivered services, compared to what were termed professional services, had better outcomes in a variety of manners, including higher service use rates, reduced rates of hospitalization, and improved senses of hope and self-esteem. And if anyone is interested in reading some articles on peer support and research, we've got sources cited throughout this presentation and a reference page as well. So I encourage you to check that out if you've got interest in delving into this more deeply. The slides will be available. Peer support services are valuable at any point throughout the recovery process. And I think that's really important to say. Preceding formal treatment, accompanying or following a treatment or a service, or delivered entirely apart from any other services that a person may choose to receive or may choose not to receive. Peer recovery support is beneficial at any point throughout the recovery or change process for an individual. So now really getting into the good stuff here, which is the benefits. So the final piece of information that we'd like to share is on how peer-delivered services benefit those we serve. Research has shown that recipients of peer services experience reductions in areas like use of crisis services, reductions in level of worry, reductions in stigma, in hospitalizations, and increases in some of the good stuff, like quality of life, increases in coping ability, increases in social network and support, increases in self-esteem and rate of employment. And I saw an article come out just a couple weeks ago, actually in April 2020 from New York University, that looked at the impact providing peer support had as a career on those folks who were providing peer support. And they saw some benefits related to that as well. So it benefits not just those that receive the peer support that we provide, but those of us who are providing peer support as well. So a number of benefits all around. And seeing those words come through the chat when we had asked you, what word comes to mind when we say peer support? Hope, recovery, resilience, victory, support, connection. All of those words, I think, really show some of the positivity that we hold around peer-delivered services. And with that, I would like to take some time to take a look at our questions. If we could bring our next slide up, please. So I'm looking in our Q&A box, and I see there are a couple of questions that are specific to peer support certification for two different states, Alaska and California. So both of those states are states that have not yet completed that development process for a training and certification for peer support. My understanding for Alaska is that that is under development right now. I'm not sure what their specific timeline is, but I might have some ideas about specific folks to connect to. I believe Eliza Eller in Alaska is currently involved with peer support, development of training. And then as far as California, I am not sure about the timeline for California. I know there have been a variety of discussions taking place within the state around that, but I don't have more specific information for that state. I also see a question asking, do you know of a peer-delivered services, oh, sorry, it just updated when we received a new question. So let me find that question again. Do you know of a peer-delivered services lexicon document or something that is like a glossary or defining what the different terms mean? So I've seen some that have some of the terms, but I would still look around for something that's more comprehensive. And I see a question coming in for Janie, it looks like, on the first slide when Janie talked about development of peer-run services. Do you ask peers in the community who are not part of your service what they want? The clinical way of saying it, community assessment.
That is a great question. For MHAAO personally, we are in the development of creating an advisory council for the services we do provide, but we also have our ear to the ground and are open to community feedback, peers that are not part of our service and what they want by attending other advisory councils, community forums, things like that. So yes, we personally, I can speak for us, do want to hear from those in our services and those that aren't.
Thank you. Thank you, Janie. Another question has come through. What has been the most common struggle with COVID-19 and not being able to see them in person due to shelter in place? Janie, do you want to take a moment and maybe I can add some thoughts?
Yeah, thanks, Adrienne. So I think the most common thing we've seen is while there still can be connection virtually, there's something missing from that face-to-face interaction. And I think that's been the most common struggle. As far as logistics and, you know, moving to a virtual service delivery, that was actually a little easier than on us technically than it was in our relationships with our peers we're serving.
Thank you, Janie. I just want to acknowledge that this can be a tough time for all of us. I mean, living throughout a pandemic, and we all have different ways that we best connect with others and that we would like for our supports to be received. So really just trying to have flexibility and grace within this time. And I see some more questions coming through. This is fantastic. I love the number of questions that we're seeing here. When can we open a peer employment agency? It's time to gather the best in the field and put our skills out there. Well, in terms of timeline, I don't really know, but that sounds like a pretty good idea to me. Janie, do you have any comments?
Yes, I think that's a great idea. I know, Amy, thank you for that question. I know that's been a passion of Amy's for a while now to see that happen. And yeah, that would be a fantastic achievement. I think on the addiction and co-occurring side of things, MAPS, at least here in this area, so I apologize, I don't have more information nationally or in other states right now, but in the Portland metro area, we have the Metro Plus Association of Addiction Peer Professionals. And while that is not an employment service itself, it's been a really useful association where we get together and earn CEUs, and there is an employment and jobs board component of that and ongoing training that's at no cost to the participants. So if we could have something like that on the mental health side, that would be very exciting.
Thank you, Janie. I was even seeing comments in the chat about a peer university as well. So a lot of enthusiasm and passion for making these things happen, which is very exciting. We've got another chat about how does one become a peer specialist in Chicago? So Illinois is a state that does have a peer certification process, if my memory serves me. I don't have the specifics about that, but I would be happy to look further into that. I might also just Google Chicago peer support or Illinois peer support specialist certification. That might get you some good information. And then also, just so everyone knows, Mental Health America National has a national advanced peer certification as well. And so that is an option that is available across the US. There are a number of experience hours and exam that goes along with that Mental Health America National peer certification, but that's an option that is accessible regardless of state that a person might live in. And then a question, are there efforts to have peer services paid for by Medicare? Janie, are you aware of any current efforts around that?
Not really. I know that behavioral health services funded by Medicare are lacking as a whole. So as advocacy happens to see Medicare start paying for behavioral health services, we would sure love to see that they include peer services in that. And I think I'll be doing some research on where that advocacy is happening, because that would be something definitely to work towards having our voice at the table for those discussions and decisions.
Thank you, Janie. And I want to be mindful of the time. We have about 5 minutes left until 1:50. So for the remaining questions, because I do see we have about 9 questions still in our Q&A box, I would like to follow up with folks and type up some responses to share those. Unfortunately, due to the volume of questions, we will not have time to be able to get to all of your questions today, but I really appreciate all of the fantastic questions and everyone taking the time to share their thoughts, comments, and questions with us today. Wanted to make sure that everyone has our contact information for Janie and myself. If you have any questions, if you want to talk more, please feel free to reach out to us. And our next slide includes all of our references in case you were interested in taking a look at the references for the information that we've shared on today's presentation. And then if we could go to the next slide, please. Just a really quick thank you to everyone who provided feedback around the development of this presentation and contributed to that. You can find out more about the Northwest MHTTC and register for additional resources and training opportunities at our website at www.mhtttcnetwork.org/Northwest. You can also sign up to receive the newsletter while you're there, find us on social media, or email us with questions. You'll also see opportunities about our online community of practices for peer supports, supervisors of peer supports, youth peer supports, lots of great opportunities available on there. And I just wanted to say thank you so much to everyone for attending this webinar today and for taking the time to learn more about this really important topic. I really appreciate your engagement, your questions, and your passion for this work. And of course, thank you, Janie, for presenting with me. Thank you all so much. Really appreciate your time and your engagement today.